Good afternoon. As Representative Tomei mentioned, the Oregon Women's Health and Wellness Alliance is a bipartisan group of legislators, healthcare personnel, state and local agency staff, and citizen advocates dedicated to promoting the health, safety, and economic well-being of women. And I'm very pleased to be the co-chair of that alliance. We are here today to join with thousands of others across the state and across the nation to acknowledge the importance of women's health issues. In partnership with the Department of Human Services, Oregon Public Health Division, we are pleased to recognize this important event. As you can see behind me, the Department of Human Services has given 5 simple recommendations on the small steps women can take to improve and maintain good health. Get at least 2 hours of physical activity per week, eat more fruits and vegetables, drink water instead of sugar-sweetened beverages, visit a healthcare professional for preventative screening, which is particularly important to us because we've done a lot of work to pass legislation in that area. And finally, seek support to help manage stress and mental health. In a few moments, you will be hearing from 2 women, Chris McDonald, who's the executive director of the Susan G. Komen for the Cure Oregon Division, and Dr. Wendy Davis, who is a psychotherapist as well as a survivor of postpartum depression, and the founder of the Baby Blues Connection, Oregon's first mom-to-mom perinatal support network, who will provide you with a personal view as to why these simple steps can make such a significant difference in the lives of women. In addition to the events today, the Oregon Women's Health and Wellness Alliance will focus on a specific aspect of women's health throughout the week. These specifics include cancer prevention and screening, sexually transmitted infection prevention and treatment, maternal mental health, and domestic violence and sexual assault. Great. Well, thank you. That concludes our presentation. We'd be happy to answer any questions.
I have covered some of these legislative priorities as individual stories, but can you characterize how you're progressing on this list so far this session?
I don't have that list in front of me. I think that we're doing very well.
Yes, I think we are very pleased with the progress we've been making. All of the bills on our list have had hearings. Many of them have already moved out of their committees, and some of them have actually passed through at least one chamber. So specifically,
I know some of them have just been recently acted on by one chamber or the other.
Right. Actually, I think the economic safety for victims of domestic violence recently passed out of the Senate, and I believe the HPV vaccine coverage passed the House.
That's right. Yeah.
And then
the clinical trials access, I think, is also
passed. That definitely passed out of a Senate committee. I think it's.
I think it has passed the Senate.
It did. And it did pass the Senate as well.
Right. Yeah.
A number of the others have passed out of their original committees and are either in Ways and Means or on their way to the floor.
Maternal mental health passed the House.
Yes, it did. It did.
And also, I believe the expedited partner therapy passed the House and is now awaiting a hearing this week in the Senate. So we're quite pleased.
On a couple of these, do you know the status of the birth? I know that's Senator Monty Anderson's bill.
The birth anomaly registry? Yeah. Yes, that is in the Ways and Means Committee for Human Services.
And paid family leave, 966.
Paid family leave passed out of the Senate Committee on Commerce and Workforce Development and went to the Committee on Ways and Means, and that's where it is.
Any other questions?
No. I know in some past sessions you would consider it lucky to get 1 or 2 of the priorities.
Yes,
so.
We're doing very well. We're very pleased with that. We've had great support from this group here and from other groups. So we've had as many as 50 people attending the Women's Health and Wellness Alliance meetings. Very supportive throughout the state on these issues that affect especially women in our society.
Thank you.
Thank
You're
you.
welcome. Thank you very much.